According to the World Health Organization records, Uganda has a high burden of both communicable and non-communicable diseases, NCDs, with the latter making up to 36% of deaths in 2019. It is this status that the Ministry of Health is seeking to reverse. One sure way is through the employment of self-care methods that include health eating, physical exercises, adherence to medication, stress management, and adequate sleeping time.
As Uganda, as a country, we are now on prevention other than curative. Before you take any medication or any interest to treat yourself, can we first test? That is it. The third one is on NCDs, our approach. We are seeing a rising number on NCDs, hypertension, sickle cells, and everything. Before marriage, can you first go for a test so that you know whether a person is sickler or not? Can you first know the HIV status of your partner before you tie that knot? So our concept is, can you have a full accountability and responsibility over your life so that you you can take good decisions and accountability. That is it.
The Ministry of Health, supported by the Uganda Health Federation, hosted key sector players to an orientation session on the merits of promoting self-care in communities.
What we do is that we brought them together today. Our role is to act as a secretariat, meaning we will continue to convene them. We will continue to translate the messages of health into the non-health private sector. We're going to continue to see how in the workplace can we make sure there's a relevant and appropriate occupational health and safety so that self-care is translated across the value chain, both within health and outside of health.
Dr. Charles Olaro, the Director of Curative Services at the Ministry of Health, is optimistic that if embraced, self-care will go a long way in reducing pressure on the health facilities across the country.
As they say that health is made at home and only repaired at the health facilities, then you will reduce the number of those who are coming to one. And when you reduce them falling sick, come to the health facilities, it definitely also has savings in terms of the money which they will invest to transport, but also will be able to save in terms of the diseases they have been able to prevent. So that's on the side of individuals. But for the health system, it also will save in that it will save time for the clinicians to be able to concentrate on much more difficult cases.
What the universal health coverage for Uganda is aimed at is to ensure well-being for everyone, ensuring that people are living healthy, people understand the self-awareness that I talked about. People understand what are the health issues, what are those small things that they should be able to understand and then act, make a decision that can benefit them to have a good health.
In places where this program has been rolled out, there are reports indicating that the population is ready to embrace it, though there is need for routine sensitization.
When we meet people, there are those ones who always forget. When after talking to them, a short while they will forget. So we need to follow them up. We need to follow up after talking to someone, embracing it and starting to do it. Then at later time we need to follow. How far? And when you heard from this meeting, there was need for follow-up on the implementation.